Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Vocal cord, and we are looking at its positions. So the first is the median. So median, the distance from the median is 0 and the units we are considering as mm. So it is seen in terms of the speech as well as the swallowing. Next is the paramedian. Paramedian, the distance will be 1 mm and this will be seen in the recurrent laryngeal nerve palsy. Next will be the intermediate or the cadaveric. So here the mm will be 3 mm and this will include the complete paralysis. Next will be the slight abduction. So the slight abduction will be 7 mm and this will involve the normal respiration. Lastly, we have the full abduction. The full abduction, it goes up to 9 mm. So 9 mm, this will include the strained respiration. To learn and grow daily like this, please do subscribe.